Hey guys, Dr. Tim Pavlak here. I'm a physical therapist and the owner of Physio Orthopedics and Performance. We are here inside of Cuyahoga Falls CrossFit, located on Graham Road. This is DPT RX episode 3. In this episode, I kind of want to cover elbow tendonitis being medial epicondylitis, lateral epicondylitis, also known as golfer's elbow or tennis elbow. Although you don't need to be a golfer or a tennis player to have this. Honestly, a lot of the people I see with this are barbell athletes. A lot of overhead lifting athletes, from pressing to clean and jerk to the snatch. It's all related to muscle tension. It's important to mention that anything seen on this show does not substitute for medical advice. If you have a specific problem, you should contact me at physioorthoperform.com. That's physio, P-H-Y-S-I-O, orthoperform.com, or reach out to your physician. Basically, our goal through DPTRX is to give you the tools to be as healthy as possible, but you should consult with a medical practitioner before trying anything seen on this show. So, medial or lateral epicondylitis can come for a couple different reasons, but a lot of times it's tension through the forearm, okay? So a lot of times if it's medial here, and it's pinpoint pressure right over all these muscles here that flex your wrist, insert into a tiny tendon right through the elbow. As you can imagine, a bunch of strong muscles that get really tight are putting pinpoint pressure either here or on the other side, an extension right through here. So if you pinpoint pain right here or on this medial side, that's most likely what you're dealing with. So the goal is to A, remove the inflammation, and B, increase the length of those muscles and release that tension. So obviously dry needling is a great thing for that. Honestly, the people I've seen who have been either medial or lateral elbow tendonitis have gotten better within, honestly, a treatment or two. It's been one treatment, but I just want to say I just kind of give myself a little bit of variance there. And so basically, goal number 1 to remove the inflammation. Voodoo Floss, Kelly Starrett, check out Mobility Watch, a lot of great stuff on there. It's going to go around the elbow, and I want you to wrap from most tension to least tension. So starting farthest away from your elbow, you're going to start wrap about 50% tension, overlapping at the halfway mark between that band. You're going to get all the way up, right to the elbow, roll up those sleeves, right to the elbow, right through there. Hopefully you have a little bit of band left once you get wrapped up there, and you can tuck that in to the band. Here you're officially set up. From this point, what you're going to be doing is you're going to be stretching your wrist this way, holding 1, 2, 3, 4, 5, and then switching directions. 1, 2, 3, 4, 5. Even for more intense, start here and extend for 5 seconds. Start here and extend for 5 seconds. I want you to do that for 2 minutes straight. If your fingers start going numb, you start getting tingling there, you probably wrapped it a little too tight and you should unwrap it. Or if you start losing blood flow into your fingers, and you can tell that by looking at the nail beds. At that point, you're going to make sure you unwrap down here first, so you don't allow backflow of blood all the way up to the top. So like I said, that's 50% stretch, overlap at the halfway mark of the band, and then back and forth for 2 minutes and held for 10 seconds each. So 2 minutes total time, 10 seconds rotating back and forth. Hopefully that forces out inflammation. This is a great thing to do at the beginning of a workout or at the end of a workout, just to get you prepped for that or recovering. What you do, number 2, like I said, we want to make a permanent change in those muscles. So we have a half a PVC pipe right here, getting really into the flexors right here, really putting pressure. When you find a tender point, that's where you're going to focus. So I find a tender point right through here, I'm really going to focus on back and forth. About 30 times, and then recheck it. Hopefully that pressure is going to decrease. If you had another tight spot, back and forth 30 times. You can do the same thing on the extensor part. Find an area. You can stand up, put a little more pressure on it, and really get into there. Increase the mobility of those muscles. The goal is to lengthen through the muscle belly and decrease the pressure in those pinpoint locations. If you graduate from this, you're not feeling a lot with that, you go lacrosse ball, kind of do like a scan up and down. Oh, I find a tight spot there, flip it over, and then you're going to put some body weight into it. And you're up and down 10 times, sideways 10 times, and the circles 10 times one way, 10 times the other. All right? Relieve the pressure, lift up your elbows, scan again, hopefully that tight spot's gone, find a new one, same thing. 10 up and down, 10 to the side, 10 circles back and forth, okay? And you should really feel tension all the way through here, up into here, through the front all the way to the insertion, and from here all the way to the insertion on the lateral portion, depending on which side you're either having medial or lateral epicondylitis. So those are 3 things you start working on to start addressing that problem. Like I said, dry needling, a little more aggressive, or taking needles and basically going inside the muscle and relieving that tension. Schedule an appointment for that, but hopefully this will get you started. So again, Dr. Tim Pavlak, physical therapist. This is your DPTRX.